A patient's perspective on the value of patient and family-centered care.
Bill and I are a family, and we're in a position in our lives where we find ourselves needing more and more care, medical care, and we of course come to this institution to do that. And what it means to me is that we are in a partnership in terms of our health. Since most of us live in families, that's where we recover our health, where we maintain our health. And so it's important that, that as we're cared for in an institution like ISJ, that be kept in mind. I'll tell you a story about it. We came into the emergency room. Bill had a tremendously dangerous infection in his leg. And I was concerned that it had gone beyond the point where he needed additional immediate care. He was concerned that he'd already spent a week in the hospital with it and didn't want to spend any more time. But we came in, and he a bit under protest. In the emergency room, a male nurse who worked with him very quickly understood that dynamic and helped us diffuse it and helped us reach a mutual understanding that Bill participated in. Didn't feel like he was being pushed around about, which I thought was really well done and important to that moment for us to make certain that we'd make the right decision and go forward with it.
Nurses are a critical part of the family experience.
I think in the inclusion of nurses and nursing in that kind of training as an elevated member of the care team is another important approach, because families get to communicate more with nurses than they do with docs. You have to be here when the doc arrives. I've really been lucky to have been able to do that and to have a doctor serving Bill who's very communicative. But I also found that the nurses did seem to me to feel empowered to talk to us about Bill's conditions, and that's very helpful.
As I get older, I find I do need more support. And so the nursing staff, being aware of that, are very willing to involve Pam in my care and in the decisions that have to be made. And they never do it in such a way that you feel diminished by it. They really support you and respect your position.
Bill is a diabetic, and one of the things that stands out in my mind is the collaboration between his doctor and the hospital, first of all. The understanding that he is the best expert at his own use of insulin. And often when he's been in the hospital in the past, he's really had trouble regulating his insulin. What they finally came to is to allow him to be the director of that, and so to watch him manage that with the nurse's assistance and how carefully they did that, but how much they allowed him to be in charge of what he knew his body was going to do with a certain amount of insulin was really very good.
Yeah, I think that insulin management was a dramatic change from past times, and it really was a partnership with my doctor, the nursing staff, and having me be able to make decisions that are important. And as a consequence, my blood sugar readings when I came out were much better than when they went in.
Patients and families expect a seamless system.
One of the interesting things about Bill's experience is that his physician is not part of our clinic structure. He's a physician, a local physician external to that, and so I have carefully watched that during this last series of hospitalizations that Bill has had. And I must say that, you know, the example that we just talked about with his insulin is a good one about the collaboration between that doctor and the local people. His access to his patient at any time was very helpful to us. His attitude toward working with the hospital was excellent, and I think vice versa. So my sense of his experience is very encouraging to me in our community, that we are working toward a collaborative, cooperative model. That's really essential, I think, to good health care. I'm part of the Health Systems Board, and one of the things that I think is critically important in that is access. It's always best to serve people closest to their homes if you want family involvement. So the work we're doing to try to assure that people get the care they need the closest to home and only work their way up into the Mayo Health System incrementally as they need to, I think helps assure that families have access, are closer to those kinds of things. Lots of people we serve nowadays are older in this hospital. And the idea that we do that in a way that makes them partners and not in a condescending way is so important to assure that they're in charge of their care at a certain level. It's very different from that old sort of paternalistic, we'll tell you what's best kind of feeling that you have in healthcare. And that's part of the family stuff too. The family really often does know best.